Can you survive the supervirus, working together with your neighbours to make sure you get through the coming pandemic? Let's find out, shall we? Supervirus is a semi-cooperative board game available through Print and Play for 1 to 6 players that plays approximately over 40 minutes with all the players playing. It uses various game mechanics in order to see whether you can survive each week, because at the end of each week you have the event, and as a result of that, will you make it through? You do have your local hospital services to help, but can they cope? That's the challenge. Will you and your neighbours survive? Let's find out together, shall we? So many of my EGP learners know I'm a massive board game fan, and as a result of the pandemic, I've had the opportunity to build this game, which I hope you'll find interesting, enjoyable, and entertaining. In addition, because we've reached 2,000 subscribers on our YouTube channel, I'm offering this game for free to everybody. Just simply go to the website below, bit.ly/superviruspmp, and you'll be able to access the game completely for free. Alternatively, if you did want to contribute, you're able to do so, and you'll get some extra content by doing so. If you've never used print and play board games before, simply you'll get an email with a PDF in it that allows you to print off the various different files. I tend to find the best way of using the cards is simply to print them off and then use card sleeves, like these, that allow you to put the cards into and put some backing, typically using either playing cards or Yu-Gi-Oh playing cards, my personal preference. In terms of the game mats, just simply print those onto A4 paper. You can print them out in colour clearly for the extra flair, alternatively print them black and white, it's not a problem. In addition, if you really want to be fancy, feel free to print off the tuck box in order to store the cards, which is designed to take the sleeves as well. But what exactly does the game do? Well, simply in Supervirus, you play one of various characters that have different powers in terms of what they can do, and we'll get to their abilities shortly. Every turn, you unfortunately do collect a Supervirus token, which is not great. However, you also have the opportunity of either playing or collecting a game card to give you powers and abilities that hopefully will mean you can survive the coming pandemic. And you will need those abilities, because unfortunately if any player gets 10 or more virus tokens, well, they become a super spreader, and as a result of that, the pandemic takes over the world. And you lose the game. But don't fret, you've got your health service to help you. The local hospital is there to try and help support you in terms of making sure you try and survive the pandemic, but you also need to make sure they don't get overloaded. And finally, at the end of every week, I'm afraid you will have to try and survive the event. The weekly event can help you, or unfortunately it can make things a little bit more challenging for you. So you will need to work together, be prepared, and see if you can survive the supervirus. In the coming section, I'm going to show you how you can set up the Supervirus base game and have a couple of turns in order to show you how the game works. After that, I'm going to show you some of the additional content that you'll get if you buy Supervirus ICU, the expansion version. And then we're going to talk a little bit about some of the cards themselves and why they're created that way. Shall we get started? So this is Supervirus, the print and play game. As you can see, I've already printed off the Airedale Royal Infirmary mat that allows you to play from the basic version, and I've already printed off the various different cards and sleeved them. In terms of setting up the game, place the game mat in the middle and then allocate each person a character card. So these are 6 blue cards that you get with the base game. With the expansion ICU, you'll get extra content for this, but simply give them a quick shuffle and then give each person a card. You could choose them if you wanted to, but I tend to find random is a bit better. So in terms of this, we've got the delivery driver and we've got the self-employed person. The rest of the character cards just put aside. Next, take the event cards. These are the purple cards, and give them a shuffle. Depending on which type of version you want to play, you can either play easy, medium or hard. So easy is 8 cards, medium is 10 cards, and hard 12 cards. I've already taken out 8 cards here. Place these face down in the event card deck. Next up, take the game cards. These are the dark green cards that you can see here. There should be 28 in total once you've printed off all of them. Simply give them a shuffle. And then deal 3 cards to each player face down. 1, 2, 3. 1, 2, 3. And then place the remainder in the game card deck, as you can see there. Next up, you need to give each player 1 healthcare token. These are the green cards that you can see here with the plus sign. These are vital in order to get into either hospital or reduce your card count. And finally, you need to give each person some virus token cards. Now, if you're doing what I do, which is to use counters, give each person a card now, and then that can be act as their token base. One there, and one there. If, however, you've printed off enough virus tokens to play with, you don't need to deal one out at this point. And that is how you set up the initial part of Supervirus. When starting the game, the last person that had a cold gets to play first. Some of the character cards have abilities that start at this point which you would need to activate. When each player takes their turn, the first thing they need to do is to take a virus token. So let's do that for our delivery driver. And then they get the choice of either taking an additional game card or playing one of the existing game cards that they have. It's important to remember that you cannot have more than 3 face down game cards at any time unless you have a card that allows you to do so. So let's have a look at the delivery driver's card, shall we? So our delivery driver has 3 different cards which all have different effects. Unfortunately, all 3 of these cards bear a bit of a risk in terms of gaining more virus tokens, but the least likely to do that is going to be the Go Shopping one. And I would rather play that than have an additional card at this point. So we're going to play the Go Shopping card. In order to do so, I just turn it face up. So I'm playing it there. And then as a result of that, I take another card from the top of the game deck. And unfortunately, I've got another card that may not help me. So I'm going to pass because I still have 3 face down cards. And then this goes onto the game discard deck. There's nothing else I want to do right now, so I'm going to pass my turn over to the other player. The self-employed character is interesting because that person gets to copy the effect of any other character. Since we're playing with the delivery driver, this means I can move one face down card from one player to another. But let's see what our self-employed player has. They have 3 cards including homemade PPE, cough, and deliver supplies. These aren't too bad, so I'm actually going to choose an additional card from the game deck as part of my turn. But don't forget, I need to take a virus token first, as it's my turn. I don't want to use my character effect, so I'm going to have to decide whether or not I play a game card or whether I take a game card. Let's have a look at them. Actually, these aren't too bad, so I'm going to risk it and go for an additional game card from the top of the deck and see what I get. Okay, that was less useful. I now have 4 face down cards if I was to pass, and I can't do that, so I have to play one of these cards. Delivery supplies moves a supplies card, which unfortunately I don't have. Cough would mean that I give one other player a virus token. Homemade PPE means I get to choose one of the following, either to unblock a hospital bed, which they're not blocked right now, or give another player a healthcare token. Or I get to play the Horde card, which gives me an additional virus token. Since it's relatively early in the game, I'm going to risk it and play the Horde card. So I'm going to play that. Unfortunately, take another virus token. I now still have 3 cards, so I can now pass if I want to. However, I could choose to use my healthcare token at this point and admit myself into hospital. But I'm not going to do that just yet. Instead, I'm going to pass and put these face down. All the players have now finished their turn, and as a result of it, it is the end of the week. That means it's event card time. So we pick the top event card from the deck. So this is the Media Storm card. This states that panic has significantly increased, and that means as a result of it, one of the beds in the hospital is now blocked. In addition, you have to play the next event card immediately. In order to block a bed, simply place the card face down in the highest number bed, as it states, and we get to play another event card straight away. Let's see how it goes. So this is the Measles Outbreak card. This states that a cluster of non-vaccinated people have contracted the measles virus. As a result of that, it increases the pressure on the hospital and it blocks a bed again. If there were no empty beds, then every player, including those in the hospital, will gain a virus token, but there is one, so we're going to block it from there. And in addition, any players outside of hospital also gain a virus token. So let's block the bed. Everybody gains a virus token. And we've now survived the event. We then move on to the next turn. At this point, if there was a patient eligible for discharge from the hospital, they would be discharged. However, there's nobody in there currently. It's the start of week 2, and as a result of that, the delivery driver has decided they want to use their effect when they play their turn. However, firstly, they have to take another virus token. Next up, we're going to move one of our cards. So I'm going to move the cough card to our other player. And the reason for this now means the delivery driver can actually take another game card without fear of having to play it instantly. Oh no, it's another sneeze card. That's unfortunate, but thankfully we don't actually have to play it just yet. So we're going to place that face down. Not going to admit myself to hospital just yet, so we're going to go on to the next player. The self-employed character could use the delivery driver's effect again if they wanted to, but not just yet. However, don't forget, you need to take that virus token for our turn. So add that on. As you can see, these tokens do build up really quickly. The virus does like to spread. However, it's important to remember that we now got 4 face down cards for the self-employed character, so I'm afraid they are going to have to play one of these cards. When we look at the cards, we can see we've got 2 cough cards, we've got a homemade PPE card and a delivery supply card. Unfortunately, delivery supply cards still can't be played because there's no supply cards face up. Homemade PPE would unblock a bed, but I think I want to keep that just for now. In fact, let's give the delivery driver back their cough card. So we're going to play this one straight away. By playing it, we give them a virus token. And then we can pass our turn. Since we only have 3 face down cards, I don't have to pick another one. I don't have to play any more. I could decide to admit myself to hospital. Still going to risk it. We've got a little bit more time before we get close to that 10 count. However, it does mean that we go into the weekly event. Since it's the end of the week, it's now time to play the event card. Let's see what we get, shall we? So, turning it over, we've got the new test is announced card. This means that all players currently in the hospital get discharged. Well, we don't have anybody in at the moment, so that's not a worry. And then you readmit any patients that are currently out of hospital, with those with the least virus tokens being admitted first. If it is a tie, then the youngest player gets to choose. Well, both of our players have 4 tokens, so I'm going to decide to put the self-employed person in first. Main benefit is you get to choose the bed that you go into. Each bed has different functions. So bed 1 allows you to reduce by 3 virus tokens per turn and discharge when that person has 4 or less virus tokens. Well, that would mean I'd be discharged almost instantly, so I'm going to take bed 2. That means, therefore, the delivery driver has to go into bed 1. We simply move the character card into the bed to occupy it. Since this is the first card being discarded, we can now put this in the event discard deck, as you can see there, face up. This means that the event is over. However, because the players were admitted to hospital after the event card was played, they don't get the reduction in virus tokens just yet. That happens just before the event card is played. So both players still have 4 tokens, and we move on to week 3. Whilst players are in hospital, they don't gain a virus token for the start of their turn, so neither of our players will have to do that, but they still do have to play their turn. So let's do that now, shall we? So for the delivery driver, he's now got 3 face down cards. He can either play or he can pick. We know his 3 cards aren't great, so we're going to play one from there. And he's got a delivery supply card, which is not going to help at this point. So I'm afraid he's going to have to play a sneeze. Give all other players a virus token. Oh, not doing so well, are we? So we put that there, face down, and the other player gets a virus token. 5 tokens. Ugh. However, is that a problem? Well, we'll see. Next up, it's the self-employed character's turn. So we've got some reasonably good cards, but actually unblocking a bed doesn't help at this point. I think we're going to draw another one. Oh, we've got the wash hands token. That could be quite useful. This allows you to discard any 2 tokens from yourself. But we do need to play one because we now got 4 cards. Interestingly, as both players are in hospital, this isn't a major problem. So we're going to play the cough card, and you'll see why in a second. Playing the cough card means that the other player gets a token. And now, since both players are in hospital, the hospital effect takes place. So, we saw before, delivery driver gets reduced by 3 tokens and discharged if they've got 4 or less. So we take off 3 tokens. And they do have 2 tokens, so as a result of that they may be discharged in the next turn. And our self-employed character gets reduced by 2 tokens and discharged if they've got 3 or less. So again, they may get discharged, depending on what happens with the event. And now it's event time. So let's see what happens, shall we? Take the top card from the deck. Oh, it's the Surge card. So the cases are rising exponentially, and as a result of that, you simply take 3 cards from the unused pile. So these are the event cards that we put aside. I'm going to take the top 3 from there. You mix this in to the existing deck. Shuffle. And you now have 3 additional weeks to play, I'm afraid. Not so great. Additionally, each player not in hospital gets a virus token. Well, both of our players are currently in hospital, so that's not a problem. So now we move into week 3. And at this point, any players that have less tokens than they need to stay in hospital are discharged. And actually that applies to both of our players, so they're both going to get discharged from hospital. There. And there. So they're both out. Tokens aren't too bad. We're not doing so bad at this point. And you continue playing till either you complete the event deck, or one of your players unfortunately gets 10 virus tokens and dies. Not so good. The key of this game is to play cooperatively. As you can see, there is interaction between players in terms of passing over cards, and clearly communication to see who's going to take some of the hits sometimes versus who's going to help. But what additional functions do you get? Well, we're just going to change over so we can show you some extra stuff. So I just wanted to show you some of the extra content you'll get if you get Supervirus ICU. In addition to all that you've currently seen, you'll also get some extra play mats. So this is the Airedale Royal Infirmary, that is the base game. In addition, you'll also get Queen City Hospital. This allows you to play for up to 6 players and has similar structure to the game board. If you're wanting an extra challenge and dynamic to the game, then you can play with this Queen City Hospital ICU, which has an extra function of an ICU department. This is a special bed that can only be used if you've got 8 or more tokens, so if you've got that critical person. And once they've been treated, they get a massive 4 tokens taken off per turn. But since they've done that, and they can't be discharged ideally straight away, they'll go into one of the lower ranked beds, depending on which one is open. If none of these are open, I'm afraid they get churned out straight into the community again. You do have to play with the capacity of your hospital, I'm afraid. In addition, in the Supervirus ICU pack, you'll also get some additional character cards. So this is the base set that you'll get, which includes various different characters. We've got the government worker, we've got the doctor, we've got the self-employed person, delivery driver, stay-at-home parents, and the unemployed person, each having various character effects. If you get the Supervirus ICU pack, you'll also get the journalist, public health official, homeless person, and the nurse. In addition, you get some extra tokens that are relevant to the journalist. The reason why this is also interesting, if you were to play with just the journalist and the government worker, you can actually have a competitive version of this deck because each person has their own win condition. Sorry to interrupt there, I forgot to mention something. So Supervirus is also playable as a solo game, as a 1 player. And when you do that, there's only a couple of minor differences. So number 1, you do have to pick at least 2 characters to play with. You can pick more, and you can even go up to the whole 6 characters to players. I wouldn't recommend that. It gets a little complicated trying to keep on top of 6 different people's stuff at the same time. 2 to 3 I find is more than reasonable. But in addition, you as the player gets to choose who goes first, which character, and then you stick with that rota in terms of who's been going. And then finally, the only difference is that when you start the game, before you've even drawn your first game card, unfortunately, every character gets 1 virus token to start off with. So you're already at a slight disadvantage. And that's just to balance out the whole aspect that you've got complete control of what your characters are doing. And that is Supervirus. Let's go back to the main video, shall we? So you GP learners, what did you think of that? That's the Supervirus game, and I hope you find it enjoyable and entertaining. As I said, to download it, simply you just need to go to the link bit.ly/superviruspmp and you'll be able to download it for free or get the extra pack, the ICU version. I'd love if you could tell me what you think of the game. I really do hope you enjoy it. In due course, I'll be doing a live where I get to go through some of the cards in more detail and tell you about the lore of the cards themselves. So make sure you join me for that. If this has whet your appetite for medic-based games and that kind of stuff, feel free to check out my other video that talks about how to play GP Bingo right here. In addition, YouTube's probably going to recommend some other kind of videos right here for you. Any comments or questions, feel free to contact me whichever platform you prefer. And as always, EGP Learning is here to help save you and your patients time by enhancing your primary care and learning and giving you a bit of fun. Catch you in the next episode.